All right. Um, that was the Clark Band, Clark Memorial Hospital Band. We're mostly hospital employees, although not all. I play trumpet in the band, actually backup trumpet. Andrew, um, can't think of his last name. Chastain. He plays the lead trumpet, and I was furloughed in 2020 and started taking up the trumpet because I had time on my hands. I was at home and I hadn't played for 40 years, and so bought a trumpet, started taking lessons, and anyway, back in the band. I love it. That was us playing at Stevie Ray's. We're playing again Friday night. So if you're available, you're welcome to come join us. We're a charity band. We don't keep any money. We raise money for American Heart Association and for various causes. This Friday night, we're raising money for an AID machine for AED, artificial heart defibrillator for Stevie Ray's Blues Bars. We had an unfortunate event in December. Our drummer, during the middle of a song, Walking on Sunshine, fell off his drum stool, drumstick went flying. He had a massive heart attack and he actually died on stage. We had a whole house full of healthcare professionals, ER people and people from all over the hospital. And we did CPR right away, but they didn't have an AED. So we yelled out, please go look for an AED somewhere, but nobody downtown had an AED machine. So Bernie died. And I'm sorry to start this video on a kind of a down note, but we raise money for charity for things like that. So if you have a chance to come on down to Stevie Ray's Friday night and hear some good rock and roll, blues, a little bit of country. So thank you for listening and watching my first podcast. My name is Joe Bradley. This podcast is being created for a class at Indiana University Southeast entitled The Social Aspects of Health and Illness, otherwise known as the Sociology of Health and Illness. And this course is one included in the Health and Humanities emphasis in the Master of Interdisciplinary Studies degree offered at IUS. I'm also the hospital chaplain for Clark Memorial Health, located in Jeffersonville, Indiana. We are located north of Louisville, Kentucky. As you cross the Kennedy Bridge, across the Ohio River that separates Indiana from Kentucky. The subject of this podcast is for briefly comparing the healthcare system of the United States with that of Sweden. I chose this option as opposed to the alternative of interviewing a healthcare worker because I'm going to Sweden next month. I'm so excited. Not only did I get a scholarship to go, but there's a group of physicians here at the hospital that are going to help pay for that. And I'm so grateful for that. And the purpose of that trip, the study abroad trip, is to compare our healthcare system to other healthcare and social support systems, this one being Sweden. Even though I work for a hospital and I know many fellow team members that I could interview, it really seemed to make more sense to choose this option since I have my trip coming up, just a few short weeks. I got my passport last week. I'm almost ready to go. So perhaps I'll do a follow-up podcast on my return to share my experience with you. We'll see. One of the main differences between our healthcare system and how that service is paid for. As we all know, here in the United States, our healthcare system continues to be in crisis because of the rising costs and the complicated payment system. Thomas Bodenheimer and Kevin Grubach, authors of an article entitled Paying for Healthcare, first published in the Journal of Understanding Health Policy, a clinical approach in 2016, summarize how we got here. We started out as a fee-for-service system, evolved into having individual private insurance companies supplement out-of-pocket costs. Then we added employment-based private insurance. Now, we've always had government financing for the poor through state-operated mental hospitals and municipal hospitals. We added government financing for the elderly with the advent of Medicare in 1965, and we expanded care for the poor through Medicaid. Sweden, on the other hand, has universal health care for all citizens, no matter their social economic status. Now, there are some fees involved to individuals, but most health care is paid for through taxes, and this responsibility lies primarily with the county councils. There were 2 scholarly journals that were used to learn about the healthcare system of Sweden. Article 1 is an analysis of the trust levels in Sweden researched by a public health survey in Scania in 2008. I think I'm saying that right. It could be Scania, but I think it's probably Scania. It's the southernmost portion of the country. Article 2 is part of a broader European and Scandinavian study involving 9 countries, with Sweden being the 9th study. This study looked at the provision of dental care. One particularly striking fact to me is that not only do all children and adults receive free dental care, but preventative dental care for elderly people are given high priority. And it's obviously effective because most Swedes have been able to keep their original teeth. According to Article 1, trust levels have been found in several studies to be a valid indicator for healthcare quality regarding healthcare provision. But the system is not perfect, and not all Swedes have positive trust levels. There are some long wait times for some cancer services as well as for cardiovascular treatments. But overall, trust remains high despite some dissatisfaction among the population. According to Article 2, half of the dentists in Sweden are employed by the public sector. All children up to 24 years of age have free oral health care. Sweden is considered to be one of the more generous systems by the government of Europe, especially free health care for all adults. It's considered especially generous by European Union standards. In addition, most fixed prosthetics, such as crowns, bridges, and implants, are reimbursed up to 85%. There are obvious major differences between the 2 healthcare systems, and the main difference is the way the systems are paid for. So I hope to learn much more about this on my trip to Sweden next month. We're concentrating on our trip mostly on care for the elderly in Sweden, and also care for those who are seriously ill and in hospice care. We will be attending lectures in the mornings, and we'll be visiting facilities in the afternoons. The trip is from May 20th to 31st, and I hope to produce a follow-up podcast on what I learned from the trip. Thanks again for watching my podcast, and blessings on you and all your loved ones. And now, more of the Clark Band.